Hello guys, Dr. Garima here. I hope all those candidates who are preparing for March 2023 have started studying really seriously now. 3 4 hours of study daily. Forget your social life. It can be done, it's not difficult. Just determination and dedication and focus is required. I'm myself going to start study for my part 2 exam. Have to practice daily, have to forget everything. But yeah, what is important, needs to be done. So, this video is to motivate you all that it can be done for the part 1 candidates. Give your best so that in case against God's wishes, of course, we cannot go, but if the God wishes for you not to clear, you know you gave your best effort, but God had some better plans for you. And if you clear, great. It means your hard work worked in the right direction. So I get a lot of queries this day asking what has to be studied and how's the study plan to be. See, you have now 3 to 4 months for 3 months now. December has started, so it's not November, so not 4 months. So 3 months, and this is how your study plan should be. You have to read therapeutic guidelines 2019. Even if you have the previous version, it's okay. There are certain things which is present in either of the one versions. Something is there in 2013 and something is there in 2019. So if you can study both, great. If you can't, stick to 2019. It's okay. You have to study therapeutic guidelines at least 4 to 5 times. I'm not kidding. There are certain tables in therapeutic guidelines which look very simple, which you think you know it, but when a specific ADC question is asked and it's asking you to choose in the hierarchy of the priorities, you have to exactly follow in the list, the order in which it's given in the therapeutic guidelines. That you will remember only if you revise. Reading it once, it's not going to help you. So at least 4 to 5 times therapeutic guidelines, and then Odell, and then certain chapters from Cameron, certain chapters from Walton, the Code of Ethics articles, and certain articles that I have shared to all the enrolled candidates. So what you should do is now we have 15 mock tests. Okay, so what I give in my course to the candidates who are enrolling for the first time, don't have any study materials. I give them all the books. I give them a proper study plan which says in the first 1 week you will study therapeutic guidelines for few hours, Odell for few hours, and at the end of 1 week you will solve one mock test. We have 15 mock tests, and mock as in they are the questions from the past exams only. And these questions are very important because they will help you understand what kind of questions are asked in the exam. They will help you to think. Study material is like me giving you, raw material. But in the exam, you have to perform by making something. It's like if I teach you the parts of a car in the study, in the exam, you have to drive the car. You need to have practice how to approach a question, how to analyze a question, understand what the question is asking you. You understand? If you don't understand the question, all the options are familiar to you, you will be thoroughly confused. And that is not what ADC is looking for. It's looking for the clarity in your mind as a clinician. So, solving mocks is very important. So, 15 mocks, totaling 990 questions. Huge. And understanding explanations of those, understanding which question, what topic. So, you will study for 1 week therapeutic guidelines in Odell. You will solve one mock. Then you should revise that mock. You should see where all you made mistake. Why did you make a mistake? Understand the concept. If you're not understanding something, which will happen in certain questions, that you will be like, why this option is not correct, and I feel this option is also correct. Then you should ask me. I will always leave a voice note making you understand, and sometimes with a lot of nice examples from your own life. Like, for example, today itself, One of the candidates messaged me. The question was, what is the least expected outcome if avulsion has happened and you have reimplanted the tooth after a long time? Least expected outcome. Uh, Options were external resorption, internal resorption, ankylosis, the tooth falling out, and spontaneous resolution. So this candidate asked me, Doctor, why isn't the answer spontaneous resolution? So I explained him in a very simple way. See, if your girlfriend gets angry on you due to some reason, and you don't even apologize to her when the fault was yours, and after 4 days of not apologizing to her, not correcting your mistake, you just walk in to her and you believe that everything will be normal, like nothing happened. Is that ever going to happen? No. So that is what spontaneous resolution means. It means like everything goes back to normal. That will never happen when a tooth has been avulsed and you're going to reimplant it after a long delay. No, something is going to happen, some consequence will happen, right? So that is the answer. Spontaneous resolution will never happen if there is a delay. Other options will definitely happen. So, yeah, I try to make it funny for you to understand the concept. Because I love studying and I love dentistry and I want the concepts to be cleared, not only just to clear the ADC exam, but for you to become a better clinician. See, dental knowledge is passed on to other dentists through the authors who have written books and through us. We are not only responsible for treating patients, we are also responsible to educate the other dentists so that they can treat the patients very nicely. And that can only happen when you imbibe the knowledge from the books. It's not possible for anybody on earth to read everything that is available in dentistry. Everybody has different sorts of understanding of concepts and knowledge. So whoever has some better understanding of the subject than you, and if that person is willing to share the knowledge, learn. I'm also a student, I'm also learning. I am very good in pediatric dentistry, but I need to learn a lot about prostho, say implants. So if somebody's speaking about it, I will just quietly listen because it's good. Even if I'm not treating those patients, if somebody is asking me about an opinion, I know something and I'll give the right advice. So don't just solve the questions thinking, oh, I should know this answer to pass in the exam. No, you should know this answer because it's helping you to become a better dentist. And when you go with this mentality, you will enjoy studying. So yeah, coming back to the topic, when you will solve the mocks, you will be confused in some questions. You will feel, you know what, this answer is right. Why is that answer not right for this question? But ask me. I will revert back with a proper explanation. So 990 questions. Uh, yeah, that's huge to solve. So one mock practically every week till your exam. So it doesn't become boring, to study just therapeutic guidelines and ODL and the other books that I've given you. So this is what the course offers. You getting all the study materials, you're getting 15 mocks of 990 questions, which you have to revise also. And you getting to ask your doubts on one-on-one basis because I don't believe in holding online sessions, mass sessions. Like I do have live sessions where I solve the mocks so that you people can solve and understand the concepts, but I don't conduct classes for subject wise. Everybody has a different understanding of subject and it's a waste of time, honestly. So you study, you ask me your doubts, but you will be added to the WhatsApp group of all the enrolled candidates, where you can also share your doubts. And I have made a daily habit to all my enrolled candidates to manifest. It's very important to believe that you can do it. So daily I have asked them to write that they are going to clear their exam. And when you write, you believe. When you believe, you send out those frequencies in the universe and things happen to help you. You will see things are happening to give you that focus for the exam. Something will be smooth for you, you know, for the exam process. You have to believe in it. So you have to daily remember it. And all my candidates write in that group. So you'll be added to that group. So this is what I have designed a course, and I take reviews from my candidates, how they are doing, what are they doing, how they are feeling, how their preparation is going. I take a review from all of them. So this is what it is. So yeah, happy studying. I hope after watching this video, your doubts will be more cleared as to what the course offers and what you will be getting out of it. All right. So yeah, best of luck again.